Hello all, my name is Richard Nugent. I am an economist and the lead developer of the HEC-FDA program at HEC. In this video, we'll take a look at ongoing research and development of the HEC-FDA program. Future products of HEC-FDA include versions 1.4.3 and 2.0. We'll discuss these two versions, take an early look at version 2.0, and think about where the FDA program is headed beyond version 2.0. FDA version 1.4.3 improves database integrity. Noteworthy improvements include checking for erroneous configuration items. If such an item is found, the program will repair the database instead of crashing. The program will also update the standard probabilities in the database for the water surface profiles when the water surface profile probabilities are changed. The number of calculation points and simulations have been increased in version 1.4.3. The number of calculation points in graphical and analytical frequency curves have been increased from 46 to 173. The max points in a stage aggregated damage function have been increased from 60 to 100. The default min and max points in a stage aggregated damage function have been increased from 20 and 30 to 35 and 60. And the default Monte Carlo simulations in the stage aggregated damage calculation have been increased from 100 to 500. There will be an option to calculate expected annual damage without risk at each structure. And finally, there is a revision to the output files. The full distribution of expected annual damage and annual exceedance probabilities will be written to the text file fda_results.txt. Also, all text output files will now have the extension .txt rather than .out. Version 2.0 will have geospatial capabilities, improved data visualization and error checking, and some important computational differences. Version FDA version 2.0 will carry out the parametric bootstrap method of resampling the log Pearson type 3 flow frequency curves to produce uncertainty or variation consistent with Bulletin 17C, the federal guidance on estimating flow frequency. There will be uncertainty around levee fragility, and this means interpreting the levee fragility curve as uncertainty in failure stage. And so FDA samples one failure stage in each realization as one version of reality, and all failures are incorporated across realizations. There will be more flexibility in annual exceedance probabilities. You'll be able to calculate annual exceedance probabilities for the interior stage, exterior stage, damage value, etc. Things other than just the channel stage. FDA will calculate assurance rather than conditional non-exceedance probability. Assurance is a more flexible metric that in the case of AEP, it takes into account of all flood events, whereas conditional non-exceedance probability is conditional on one event. Multiple conditions will be possible within a given plan, and users will be able to vary uncertainty between ordinates. Let's now take an early alpha version 2.0 look at the software. So let's take a look at HEC-FDA version 2.0. 2.0 is going to look a lot like HEC Life Sim if you're familiar with that software. The structure of the graphical user interface consists of a study tree, which you see in the left-hand side panel, and a map window on the right-hand side. The capabilities of 2.0 include selecting structures by the map, and I have just done so, and the structures I selected are now highlighted. Structures can be selected by characteristics using a field calculator. The field calculator can also be used to make changes to the structure inventory. And this is, again, all building on top of the capabilities in LifeSim. And these are capabilities in addition to what we have just discussed. Let's look at the workflow. The workflow can be viewed through the study tree and is in order of the study tree. The first thing to do is to identify the terrain. And we have identified the terrain. The terrain will consist of a shapefile. You can see the terrain in the map window on the right, and that is this colorful this colorful layer on the right. Then identify the impact areas. The impact areas are like damage reaches, and these are geospatially oriented. This will be a polygon, and the structures will be associated with a polygon. The impact areas will be also a shapefile. The water surface elevations, or these will be stage rasters or depth rasters. One for each hydraulic profile will be imported. A geotiff file. So we have one, each profile has its own layer. The flood frequency function can be fit from parameters or flows, and the flows just have to be from an annual maximum series, and so we'll have an analytical flow frequency. You can see what that looks like. You can create the analytical flow frequency, and it has a plot here. You can fit to parameters or you can fit to flows. Let's look at a rating curve. You can then determine your rating curve, identify a levee. You can use a default failure function, or you can determine your own failure function. But a failure function will be used either by default or as identified by the user for HEC-FDA version 2.0. The structure inventory will be imported as a shapefile, and we can see the structure inventory in the map window. A good source for this is the National Structure Inventory. We can use the aggregated stage damage relationship here to calculate this relationship. And then from there, something that's new about the way that we do analysis is that we can create conditions, and with the conditions come up with plans, and with the plans come up with alternatives. Now, what does that mean? Conditions may represent different measures. And then sometimes in plan formulation, you combine different measures into a plan and compare plans. And so the software is going to facilitate that. Let's take a look at a condition. In this condition, you see the flow frequency function, the rating curve, and the stage damage curve. And this looks a lot like the plots that you see in Engineering Manual 1110-2-1619. The thing that we're looking for here is that we have consistency or overlap in these functions, that there is no part of the function that does not correspond to another function. And we will be able to then preview the compute in this lower right-hand side plot here. Okay, that's it for our quick look at HEC-FDA version 2.0. Now let's take a look at what is to come after HEC-FDA version 2.0. Now, beyond version 2.0, the capabilities of HEC-FDA are likely to be merged with HEC-FIA and LifeSim, and may include cost analysis within the program. If you have any questions, please feel free to email me, Richard Nugent, or or post your questions to the Discourse discussion board. Thank you.